Right, I think I'm going to get started with welcomes and introductions as people join and our last candidate joins. Good afternoon, everyone, and welcome to the Vermont Medical Society U.S. Senate Candidate Healthcare Policy Forum. My name is Simi Ravven. I'm the Chief Medical Officer at Howard Center and the President of the Vermont Medical Society. On behalf of our members, I want to thank the candidates who have taken time out of their busy campaign schedules to participate in the only health policy forum we know of, leading up to Vermont's primary elections on Tuesday, August 9th. In terms of the format of today's event, each Democratic and Republican candidate running for the U.S. Senate seat was invited. Unfortunately, Congressman Welch is in session in Congress and U.S. Attorney Nolan is not available. I will start by giving each candidate a brief introduction, after which each candidate will have the opportunity to answer 3 questions on healthcare policy. Each candidate has received these ahead of time and will be given 2 minutes to answer each question. We will ask 1 question at a time of each candidate and we'll be using a timer that can be seen by all. When the 2 minutes are up, we will let the candidate know and move to the next candidate. Since we have limited time, we know you will all respect these time limits. I urge VMS members that have questions for the candidates to put them in the chat. We anticipate today that we should have plenty of time for additional questions after our 3 primary questions. And then we'll give each candidate 1 minute to answer these additional extra questions. If we don't get to your question, we will send them to the candidates that move on to the general election, and we will publish the answers both on the VMS website and in the next issue of the Green Mountain Physician. I'll now go on to introduce the candidates. Isaac Evans France is a Democratic candidate. He has been a reproductive health educator and community organizer. He grew up in Brattleboro, Vermont, and lives there today with his husband. Gerald Malloy is a Republican candidate. He is a combat veteran with 42 years of military and government service. He lives in Perkinsville, Vermont, and has 4 children. Myers Mermel is a Republican candidate. He is a real estate finance professional and lives in Manchester, Vermont. He attended UVM and worked as an intern for George H.W. Bush. Nikki Thran is a Democratic candidate. She is an emergency medicine physician who practices at Gifford Hospital. She lives in Warren, Vermont, where she is an active community member. Our first question this afternoon is, what should Vermont physicians and healthcare professionals know about why you are running for Congress? We will start with Isaac Evans France. You have 2 minutes.
Sorry, Isaac, can we actually just interrupt? I hate to do this, but we do have Gerald Malloy. He's logged in and on the webinar. Gerald, we're trying to promote you to a panelist. So if you get that promotion, can you accept it? And then we can see you and you can join the conversation. Hold on 1 sec.
Yeah.
I appreciate your commitment to inclusion.
Yes. Great. I think it worked. So just give us a moment. Technology is great, but we're not all together. So
Fantastic.
yay. Okay. Simi, do you mind reading the question one more time? Just because I think Gerald was probably distracted trying to log on, and then we'll get
I'd be happy
started.
to. Sure.
Great.
Good idea. Our first question today is, what should Vermont physicians and healthcare professionals know about why you are running for Congress?
Okay. Is it to me?
And I'm sorry, we'll start with Isaac.
Thank you, first of all, to all of you who are physicians and medical care providers for your service, especially during this time of the pandemic. This has not been easy, and I thank you for your work. When I was 13, growing up in rural Brattleboro in a low-income family, I told my father that I was gay. And his response was that he loved me, and he hoped I would be very careful about who I told, and to be very careful not to get AIDS. So from a young age, public health has mattered to me. It's been a focus of my life. It's been a focus of my work. It's connected to my becoming a wilderness first responder in my early 20s, and my becoming a certified lactation counselor, which I am today, my work as a certified professional in healthcare quality. I worked for 7 years, 8 years in federally qualified health centers, both as a sexual reproductive health educator, providing pregnancy options counseling to patients who came to the center, as well as HIV testing and counseling, birth control support. And I have also worked as a quality coordinator for an LGBT community health center. My experience there led me to see how providing care for patients was just one piece, but I could see all of the problems that were driving people away. My job, I'm sure that many of you have experienced this, when you are a provider and your job is to provide care. Having to turn away a patient or see them not get the care they need, you're not being able to do your job, is one of the most heartbreaking tasks. And I want to create a system where we bring the voices of everyday Vermonters, folks like myself who've been organizers, who've built national coalitions for peace and social justice, but people who are organizers can get to Congress, can bring fresh energy, because right now, to take on the unprecedented crises facing us in terms of the climate, in terms of healthcare, housing,
2 minutes.
abortion rights, we need
2
the
minutes.
voice. Okay, we need new voices. Thank you.
Thank you. Moving to Gerald Malloy now.
Well, thank you very much. So my name's Gerald Malloy, and I am running to be your next United States Senator. And I'm running because of the situation with our current administration. I think our country is clearly going in the wrong direction. And I've looked at the candidates. I do believe I'm the best qualified candidate to provide what I think is missing, mostly with our current administration, and that's leadership and performance. And I base that off of my 42 years of service. From West Point. I've also earned an MBA. I've served around the world in the military with about 20 NATO partners and allies, including being decorated in combat operations, nuclear surety positions. I've also served on 20 presidential disaster declarations, worked across the U.S. government, including with HHS and the law enforcement community. And then for the last 11 years, I've been in business. So in a highly competitive business environment, mostly as an executive, mostly working in the greater DC area. And that's also providing services to U.S. government organizations, mostly U.S. government organizations. In doing that, that involves building relationships, and it involves engaging and listening and developing complicated solutions to solve problems for customers. So I've been successful doing that. I guess, I'm also a parent. And so as a Vermont parent, I see the future for my children, and many parents, parents like me, are concerned about the future for their children. So I want to go in and make change for a better future for our children. My platform is you can go to my website, Deploy Malloy. It's abiding by the Constitution, promoting economic prosperity, and ensuring defense, security, and order. Those are 3 areas that I think our current administration is failing. I would also say one point I want to make, I will use my extensive business experience to grow jobs here in Vermont. That has not been happening. I would look to engage. I have a wide network.
Thank
of
you.
businesses.
That's 2 minutes.
What was it? That was quick. Sorry. Thank you.
Yeah. Moving on to Myers Mermel, please.
Thank you very much, Jill. My name is Myers Mermel, and I'm running for U.S. Senate. And I live in Manchester. I do want to say that this has been a well-publicized event, and I'm very disappointed that Peter Welsh and Christina Nolan have not joined. I know from working on Capitol Hill that nobody works during lunchtime, so he would be available, and Christina Nolan has not responded. So I think the medical community should understand that the people on the phone or online are interested in your health and well-being and your success, and those people that are not have shown that they don't have time for you. So I want the physicians across Vermont to know that I've been endorsed by the American Association of Physicians and Surgeons. I come from a medical family. My father was a Navy doctor. Then he was chief medical officer for the State Department and the CIA, served abroad for 25 years. My mother was doctor of nursing science, went on to become dean of the graduate nursing program at Georgetown, and then later was acting UN High Commissioner on Afghan refugees in Afghanistan. Lastly, my sister, my only sibling, is an oncologist in Lynchburg, Virginia, the leading one there. And I would urge anybody, if you're in Central Virginia, to look her up. So by way of introduction, I understand the complex relationship between the medical community and government, and I understand how it's evolved over the past 20 to 25 years. I can't give you a remedy and I gave a prescription in 10 or 20 seconds or 2 minutes on how things be remedied. But I want to make the point that all the solutions that have been used across Vermont to solve these cost issues that we've had and to solve the crisis that we're suffering under in terms of delivering good care, letting people access care quickly, being safe in our hospitals, none of this has worked. And so we need to reassess how we're doing things. Thank you. That's 2 minutes.
That is 2 minutes. You were just under, and I think Jill is frozen. So we are going to move now to Nikki Thran.
Hi, thank you. I would like to start today with an acknowledgement of the Abenaki people of the Dawn and the members of the BIPOC community of Vermont. I would like to acknowledge and honor their elders, past, present, and those of future generations. I pledge to right the injustices of the past and work with them to ensure an equitable future for us all. I am running to be the first female senator from the great state of Vermont for many reasons, but the biggest reason is because I feel like I can help more Vermonters in DC than I can at the bedside one at a time in the ER. Having been in practice for 30 years, and don't get me wrong, I love emergency medicine. I love medicine as a whole, but our practice all of our practices has seen a change, and most of it has been loss of our autonomy as professionals. We are constantly squeezed between hospital administration, pharmaceutical device manufacturers, and health insurance companies. And that was the primary reason I decided to enter the race. I believe we need a national healthcare insurance for all Americans, but I differ from my opponents that this would not be a single payer program. We need to elect candidates who are intelligent and who are basing policy not on emotion or religion, but on facts and on science. And I would encourage everyone here at this meeting to consider running for office. This has been a wonderful experience for me, and I look forward to impacting healthcare in Vermont for many years in the future. Thank you.
Great, thank you. Just under 2 minutes. Jill was worried going into this that she may lose internet due to some storms going through her area. So I will take over as the time, helping with the timekeeping. And we are, Simi, ready to start the second question.
Thanks so much, and thank you, everyone. Our second question is, in the absence of movement on major health reform in Congress, what are your short-term goals for improving access and affordability in our healthcare system? We will start with Isaac Evans-France. You have 2 minutes.
I do support Medicare for all, and one Medicare for all that includes mental health care, dental care. But the road to getting there, let's talk about that. So one thing that we can do is we can lower the cost of prescription drugs. We can do that by investing in public research for pharmaceuticals. We can lower the Medicare retirement age to 50. We can publicly fund, as I mentioned, the pharmacy research. We also need to stop the stealth Medicare and Medicaid privatization. My support for universal public health care, I believe, is part of the reason why I've earned the endorsement of the Vermont Progressive Party, and that I hope to earn your support as well. I support the movement from a fee-to-service, free-for-service model to value-based system, and that's what I spent 5 years of my life doing as the quality coordinator for a federally qualified health center. In my work, I helped improve systems that led to increased colorectal cancer screening, increased mammography, increased testing and treatment for people with diabetes and with HIV. I support reforms to the Veterans Affairs health system. I am interested in expanding our workforce so that not all the weight falls on medical care provider. It was awesome to provide the research for a coalition in Vermont that succeeded at expanding the dental workforce so that we now have a path for mid-level dental practitioners to practice in this state. That's the sort of energy that I bring as an activist, as a national coalition builder for peace and social justice. I see the need for reducing the cost of medical school for primary care medical providers. And we need to maintain and expand services in rural areas, especially for primary care providers. Investments in primary care is prevention. That's what we know. And we need to have a public health approach to how we are providing medical care.
Time. Thank you. Moving on to Gerald Malloy now. You are muted, Gerald.
Is it? Muted's not going to work, is it? Sorry. So in terms of a short-term goal, I regret to say that I've had some recent conversations with a woman whose service member's son recently took his own life. And I've also had discussions and received all the full details about the challenges he faced after discharge in terms of scheduling and receiving care and counseling services, and obtaining his medications, and then continuing to obtain his medications in a timely manner. You've probably heard or seen of organizations like Mission 22. So there are about 20 veterans commit suicide every day. And that is about coming up on 25% of the suicides in the United States. So it's a tragic problem. And it's been going on for years now. And I would look to enact legislation immediately upon taking office to try to resolve or at least improve upon that problem. And in that respect, I would look at processes and policy and funding and staffing for within the VA and maybe outside the VA for maybe 60 days or at least a certain amount of term for any veteran that has separated to be able to get to the top of the line, so to speak, to ensure that they get services. In this particular case, it was someone who had warning signs and had actually had a family history of depression. And what happened is it took him months to get seen originally. He was seen, and then it actually, part two of the problem was that his medications were done by mail, and that took much longer than it should have in some cases. So I would look to enact legislation to begin to solve that problem crisis as soon as I took office.
Great. Moving on to Myers Mermel.
Mermel, but
Mermel.
you could say it anyway. I think we need to be clear with my history as a business person for 35 years. I'm bringing a special skill set to the table. And I think reforming our healthcare system in Vermont is an urgent priority, and it will need federal and state help. it's very clear with Rutland's announcement that it needs an 18% rate increase, that things are not working. Unfortunately, a lot of the solutions to healthcare have become highly politicized. And I'm kind of a John Dewey-esque conservative, more pragmatic. And I think we need to strip away some of, our well-intentioned political ideology and move to real solutions that service the consumer, the patient, the people of Vermont. And they're not getting the service that they deserve. I know you want to provide it, but I was surprised to see on the VMS board, for instance, I have a Yale degree as well. I have a degree in theology from Yale. I also have an advanced degree from Columbia in American history. I'm probably the most formally educated person on the Republican side. But I was surprised to see the VMS board does not have anybody who is a business person, just doctors. And I think rationalizing your business, getting costs under control, making decisions about what the priorities are is incumbent upon VMS to do. This idea of one single payer is not working and it's too expensive. There's not enough money in the world to finance single payer. So I think we need to start rationalizing how we look at healthcare. And I would ask VMS to be a partner in this. At the federal level, that's something I would do. I would ask Dr. Ravven to go back to Yale School of Management and recruit somebody to work with her on the board so that we can start to plan across the state. Thank you.
Great. Moving on to Nikki Thran.
So the first thing I would do is introduce legislation for a national medical license that would apply to physicians, nurses, associate providers, lab and x-ray techs, and respiratory therapists. This would allow us to deploy medical personnel to the places where they are needed most and prevent all the money that we are spending on travelers. And I think just about every hospital in the state, and the money is just leaving the state. So I think that would be a great short-term first step to help nationally with the inequities of healthcare. We do need to support rural healthcare. We need to reimburse primary care and preventative health measures the same way we are with interventionalists and specialists. We have to, I would like to see an amendment, the 28th Amendment to the Constitution that gives a right to healthcare as a constitutional right. We need to regain, after the Dobbs decision, I feel that the government has interfered with the relationship we have with our patients, and I will work hard to preserve the physician-patient relationship, which to me is sacred. The Dobbs decision is the opposite of shared decision-making. It is the government telling us what to do. We need professional autonomy. We need body autonomy. And I will certainly work to for those goals, as well as universal health care for all Americans, which I would argue, Myers, that we can absolutely afford.
Great.
Great. Thank you all. We have a third question today. What are your top public health priorities? And we will start with Isaac Evans-France. You have 2 minutes.
In this moment, abortion access is a top priority. That includes telehealth so that people can get abortion pills by mail, means clinics on federal land, and that means vouchers so people can travel. More broadly, I see the 4 C's of climate crisis, COVID, conflict that's violent, and capitalism that's gone to a point where we have middle-class families in Vermont that are paying more in taxes than billionaires in this country. Those all result in public health crisis, because when people are poor, when people are stressed, when people can't get the care that they need, that is a crisis. I'm an organizer. I built the largest anti-war coordination and mobilization since 2003, when I organized the Global Day of Action, World Says No to War on Yemen, where 400 organizations from 30 countries participated and tens of thousands of people. This was Biden's first Monday in office, demonstrated in the streets and participated online. We had members of Congress participating. I did that as a volunteer. It's something that I was passionate about, something that I believed in. And I've brought that kind of passion to Washington when we've passed bipartisan legislation to get the United States out of this war. We're still working on this, but we believe that we can do this. That's the sort of energy that we need in Washington to address all of these crises. I had the privilege, because of my success with the Yemen solidarity work, of being asked to build a national coalition for a global economic response to the pandemic. And in that process, brought together over 100 organizations representing tens of millions of Americans. And we got legislation passed through the House 3 times and got policy change at the International Monetary Fund, where 190 countries got emergency relief during the pandemic. That sort of leadership and organizing is exactly what we need in Washington right now, because the status quo is not working for my family and it's not working for so many Vermonters.
Thank you. Moving to Gerald Malloy.
Thank you. So I meant to say we had a terrible rainstorm and it got humid as heck here. So I'm a little bit, but thank you for the time. 2 things I wanted to kind of cover quickly. Number one is the fentanyl crisis. So last year we seized 10,000 pounds of fentanyl in the United States. That's enough to kill 2 billion people. It is the major cause of the 100,000 overdose deaths that we're experiencing. It is a synthetic opioid made mostly in China. I call that chemical warfare. So I would look to impose sanctions on China to reduce the flow of fentanyl coming up into the country. I would also look to continue and build the wall to, again, slow the amount of fentanyl being smuggled into the country. And third, I look to go back to fully supporting our law enforcement community and giving them the right and the confidence to arrest and put criminals in jail. Number one, second piece I wanted to talk about was what I call customer transparency and choice. Recently talked to a cancer patient that requires MRIs. And that MRI, they come to find out, the person comes to find out, could cost $1,600 or $2,800 or $3,600. He doesn't know until it's done. I think we need more transparency in the pricing and more information to the customer for choice. And I think that will end up lowering costs for medical services. So thank you.
Great. Moving on to Myers.
Yes, can you hear me?
Yes.
Yeah, unfortunately, I'm in the midst of this Franklin rainstorm. But there's certainly, from my perspective, there is a public health emergency in terms of public safety and the drug trade in Vermont. Public safety is an issue which should be close to home. As I understand it, the UVM nurses and medical technicians and staff are under threats in their own hospitals that are not being responded to. Our prosecutors are operating under a philosophy of restorative justice, but unfortunately, the way it's implemented has nothing to do with restorative justice, and we need system. I do not believe that capitalism is the enemy. I think market forces and taking advantage of the market can help us rationalize how we deliver healthcare and deliver it efficiently. We need to restore the primacy of the physician-patient relationship, which unfortunately has been eradicated by some of these large government solutions. And I have faith in the doctors and nurses of Vermont that they can do their job capably without government interference. So I would put my emphasis on public safety and also stopping the opioid crisis, which is decimating low and moderate income Vermonters, and is a horrible thing we cannot allow to continue to happen.
Thank you. Okay, moving on to Nikki Thran.
So I think that the problem that America is facing with gun violence is a public health emergency. It relates to the opiate crisis because the people who more in Mexico, I agree that most fentanyl is manufactured in China, but a significant portion comes from Mexico. And the drug cartels are armed with guns that our country produces. The number one cause of death of young people in the United States is firearms. The number one way that suicide is completed is firearms. We need a ban on assault rifles. We need 100% background checks. We need to stop ghost weapons produced by 3D imaging. We could go on and on. So that is a really important public health issue that I'm going to fight for. I've already alluded to the Dobbs decision and the loss of bodily autonomy, which relates to all of us. I disagree. We need to get corporations out of healthcare. We can't be profiting off of other people's illness. Corporations' responsibility is a fiduciary one to their stockholders, and that does nothing for our patients. We need to invest in preventative health, in public health, and I can guarantee you that taking care of uninsured patients costs more than patients with insurance. So universal health care is absolutely an important base to all of our healthcare nationwide, as well as in Vermont. Thank you.
Thank you so much. And a thank you to all of our candidates and all of our VMS members who've joined us for this candidate forum. We're now going to turn to some of the questions in the chat. The VMS staff will choose the questions to ask, and then each candidate will have 1 minute to answer. We'll try to fit in as many questions as we can.
Thank you. Jessa Barnard here. I'll try to be fielding some of these that are coming in both over the chat and the Q&A. And first, a comment from a longstanding VMS member. I think this was in response to one of the earlier candidate responses that medical practices are small or even large businesses, and many of our VMS leaders have sought formal or informal administrative business and leadership training promoted and supported by the VMS to support continuous improvement of operations in our practices. So that was just a response comment. Thank you, Wendy. A question that has come in is, what would be one of your top strategies to address shortages of specifically the primary care workforce, but also the healthcare workforce more generally? And I think, let's see, Jill, are we doing the same order
Let's
for
do the same
questions?
order. Just keep
Okay,
it
so
simple, and
great.
it's 1 minute answers.
All right, so Isaac.
Sure. So one program that I've seen successful is the loan forgiveness program for people who decide to provide service as medical professionals in high needs areas, which would include many of the rural parts of our state. Another way that we've been able to expand the medical and dental workforce is through mid-level practitioners like nurse practitioners, physician's assistants, and in the case of dentistry now in Vermont, something that I worked hard for and helped build organizing for around the state was the mid-level dental practitioners. That kind of approach is a way of bringing more people into the workforce and making sure that we're meeting the needs of Vermonters. Thank you.
Thank you. Gerald.
Thank you, Jessa. So thinking about that just now, I will say my daughter, I have one daughter, and she is a nursing student, and she's been enrolled at UVM and is very much looking forward to becoming a nurse. One of the things that's happened in the last 2 years is she's taking actually a larger course load of online courses to include through CCV that are being able to funnel up to eventually reaching that degree as a nurse. And that is actually significantly lowering the cost. So that's one piece that I would mention. I think that's all I can think of at this point right now.
Thank you. Myers.
Yes, there was an op-ed, I think about 2 years ago, that talked about the staff shortages that are being experienced. And one of the suggestions, and I don't know if VMS has responded, is to actually expand the size of its classes for nurses and others. And I think as part of that, what you may do is kind of extend a hook for those that graduate from your nursing programs to stay with some sort of debt forgiveness funded by your own endowment. So you'd have to go back to, the community, to your own people, to raise endowment monies to defer some of their debt or to pay off some of their debt. But that's a way to attract people. I think, there's a free market for nurses. My cousin is a doctor of nursing science and traveled the world. My mother was dean of the graduate nursing program at Georgetown. I think you're going to have to pay more, unfortunately, and you're going to have to rationalize how you pay more for those staff. And that means that you're going to have to make decisions elsewhere about what to cut. And I think that's something that's the discussion we need to have. And I think my minute is up.
Perfect timing. Thank you. Nikki.
So as I alluded to earlier, I would introduce legislation for a national healthcare license for all practitioners. I also think we need much more transparency. I've heard a lot about patients as consumers this hour, and patients don't have any choice about whether they can buy an MRI or not. They are forced to go through hoops that are given to all of us by health insurance companies in the guise of saving money. But I think we need to allow patients to decide whether they want to be able to buy a test or not, and not have it be a gateway through the insurance company. I do think we need to expand the types of insurance that cover alternative healthcare modalities that all of us know our patients use and benefit from, and which often are less expensive.
Thank you. And just a reminder to members, please keep typing in other questions. We have one queued up, but we should have time probably for more if there are more questions from our audience. So while they're getting prepared, question about how would you address our crisis in access to mental health care services, both inpatient and outpatient? And we know Vermont is not alone in facing this, so it really is a national issue. So we will start with Isaac.
One of the programs that I've seen particularly successful is peer-to-peer counseling, programs that allow communities to provide support to one another. We need to invest in sorts of programs like I know we have in Vermont with hotlines for people to call. Well, we need to be investing in social work. We have a shortage of social workers in this state. There's been such a loss during the pandemic and such a high need. We also need to be getting money out of politics. And I think that Dr. Nikki Thran alluded to this, but I would argue that we need a Medicare for all system. We need a universal public healthcare system if we're going to do that. And one way that we are all different than Congressman Welch is that he has introduced legislation at the request of the pharmaceutical industry, making it easier for drugs to get onto the black market. He did that at the request of pharmaceutical industries that had donated to his campaigns, that he was trading stocks in that industry. And so when we have politicians who are embedded in that system where there's so much money, politicians like himself who have taken $4.5 million. Okay, we need new voices.
Thanks. Sorry, I missed the timer there myself. Gerald.
Thank you. So I actually, in the wake of Uvalde and Buffalo, I watched the legislation related to increasing healthcare capacity, and I applaud that. I had done some research. There was a point where we had 300 beds per 100,000 people for mental health care. That's gone down into the teens over the years, so I would look to increase that. I also spoke about increasing policies to share and act on the warning signs, for instance, for young adult shooters like happened in Uvalde and in Buffalo. I also talked about maybe national programs, because there's a divisiveness in the country, national programs to build a sense of community and really kind of promote young people to get back into the church. That's my answer.
Thank you. Myers.
Yes, it's been a source of much concern to me that while we're very focused on gun control legislation, which I do not think will be effective, that we have overlooked fuller funding of mental health priorities in the state. And we are certainly underfunded. We could have been more funded this year. Senator Leahy left $488 million on the table in federal appropriations. His second in command got $650 million from appropriations, and Senator Leahy delivered 162. So we need our federal representatives to get our fair share out of Congress and the federal government to protect us. That's one of the things that I think I would be very successful at doing, is working the system in Washington to bring more money back to these social imperatives. Our current state of mental health care and is just frustrated at so many levels because of lack of funding. And this is something that is a clear priority and cannot, if we want to stand for our Second Amendment, we can't do that without corresponding increases in mental health care.
Thank you. Nikki?
So I absolutely agree with the other panelists that we need to increase funding for mental health. Every day that I walk in for a shift in the ER, pretty much there's a psych boarder in the ER. We have they stay there for days, sometimes weeks, and that's an issue. To me, it's cruel to leave somebody waiting for a psychiatric bed. And I could tell you many stories about that firsthand, and I'm sure most of you out there have your own. The problem is that if we could have cured mental health, we would have already done that. We can't cure all the mental health issues nationally. We need to reimburse mental health providers and provide subsidies for them so that they're reimbursed at a fair rate. But we also need institutions that will help pay people with psychiatric problems so they don't end up on the streets or in jail.
Thank you. Time. Thank you. Another question that has come in. I'm just looking at the time here. I think that we do have time for a couple more. Perhaps the most pressing healthcare problem nationally is the threat to patient autonomy represented by the Dobbs decision, not to mention the door that it opens to infringement on other rights. What would you do to support the reinstatement of the right to reproductive choice nationwide and to protect it moving forward? I know some of you have addressed this in our earlier comments, but I think we could hear the answer from everyone. So with Isaac starting.
Yeah, so I'll add that reproductive rights is the floor, it's not the ceiling. I know from having been a reproductive health educator and working in community health centers that just because someone has the right legally doesn't mean they actually have the means. So we must prioritize getting the resources to people when they need that and making sure that people get the care they need. So I mentioned before, but telehealth, abortion pills in the mail, clinics and federal lands. These are some of the ways, the vouchers, so people can travel. I mean, we have a right to travel in this country. That's a fundamental right. And one last thing about the slippery slope thing. I know that an attack on your body, on your bodily autonomy, it may be today, but tomorrow could be my marriage. The day after, it could be all of our rights. So we must stand together in this time of unprecedented attacks on the really hard-earned rights of all Americans.
Thank you. Gerald.
Thank you. So from the beginning of my campaign, I supported my belief per the Constitution, specifically the 10th Amendment, that Roe v. Wade should have been overturned and given to the states respectively and the people, which is what it says in the Constitution. So that's happened, and I support that. I am pro-life, and I will vote as a Vermonter based on my personal beliefs. Thank you.
Thank you. Myers.
Yes, this is an important issue. Certainly we have Prop 5 coming up, which I expect will pass. According to Pew Research, Vermont is the most pro-life of all the states across the nation. And as I've said, most pro-choice state of any state across the nation. I'm personally pro-life, but I won't impose my own views against the will of the people. The people have their own decision to make, and I will fully support that if that goes through. Unlike my opponent on the Republican side, I have not called for a 50-state ban on abortion. I have not associated with white supremacists that are calling for that, not endorsed by white supremacists. So I'd like to bring some calm and reason to this debate, and reassure people that their rights will be maintained in Vermont per this plebiscite, which will come to pass in November, but that I have my own personal religious beliefs, but it won't stand in the way of me doing my job for the people that elect me.
Thank you. Nikki.
So I appreciate that you won't be making policy based on personal decisions, because that's not our job as politicians. We need to fight this on multiple fronts. I would advocate to expand the Supreme Court to 13, which is the number of federal circuits nationwide. This to me is a religious issue brought on by the religious right. It is not my personal religion. I don't believe it. I believe that the life of the mother should come first. And primarily, I believe that the decision whether to terminate a pregnancy should be one that is made between myself and my patients. And we have already heard horror stories, I'm sure I'm not alone, about women who are suffering because lawyers are deciding when they can intervene medically. That is wrong. It needs to stop, and I will fight it every way I can.
Thank you. We have one more question that's come in. Again, if anybody else out there listening has any last questions to type in, please do so in the chat or the Q&A. In the meantime, I have one more here. What is your position on whether the federal government should fully fund all prenatal, labor and delivery, and postpartum or early childhood care? So pretty broad, again, just to repeat it for you to have a minute to think about it here: prenatal, labor, delivery, and postpartum and early childhood care. Should that be federally funded? So starting with Isaac.
The answer is very simple, yes. As somebody who's worked in an infant mortality reduction initiative, case management supervisor, and who has provided pregnancy care as a prenatal education and postnatal education, this is a priority. The start to life is so important. And I do believe in the preciousness of human life, and the babies, we must provide them and their parents with the best care possible. So this is absolutely a priority. As a certified lactation counselor, this is an easy one for me, that we must invest in our families and in the future. So thank you for that. And I will say one more thing is that these policies that most of us support here in terms of increasing access to care, lowering the cost of care, getting this out of the hands of corporations and returning the power to medical providers and their patients, the only reason we don't have these is because of a political system, an entrenched system. And we need people at this moment of crisis who are willing to stand up, who are willing to organize and bring new energy into the conversation.
Thank you. Gerald.
Thank you, Justice. So I would want to look at that legislation, but my initial impression would be no, not to support all those, to provide all that support at no cost. I did want to go back. Mr. Mermel, I think, made a comment about being a racist. Well, I'm not a racist. I have actually recently invited the entire everyone I've spoken to my home. So, sir, you are not invited to my home. I've worked for 4 African Americans. I've been in the Army for many, many years. I'm the last person in the world that anyone should be calling a racist. So, thank you.
Thank you. Myers?
Yes, Mr. Malloy, I wasn't invited in advance, and I have my own place to eat, but thank you. I wasn't calling you a racist, and please don't put words in my mouth. You were endorsed by Mark Koster, who's been flying these white supremacist flags. You haven't said anything about it. That's your issue. What I'm saying is that we can't do those types of things and expect to represent Vermont fully. That's just not right. It's not moral. So on the issue of prenatal care, I would like to see the cost. I know that child care is a big issue in Vermont, which is a separate issue, postnatal care. And we need to look at that more heavily. I'm not sure where we can find the funds, but certainly everyone's intentions are good on these things, but there are limited resources, and we need to do the best we can in delivering the best care we can in the places we can.
Thank you. Nikki?
So my answer is yes, we do need to fund prenatal care and postnatal care. I would support government supporting public education through high school, and I have ideas about higher education as well. It is clear to me that we don't spend enough on family medical leave, which we need to implement universally throughout our nation. And this is part of prevention, is investing in infants and children at a young age where we can really make a difference. So I am 100% behind helping, especially those patients who are forced now to carry a pregnancy to term that they did not want. Most of those people need government support. And if you're gonna tell them they're forced to give birth, you better be able to support their children financially.
Thank you. I will turn it back over to our president, Simi Ravven, to close up the afternoon.
Thank you all. I want to thank all of our candidates and our VMS members for attending and for the robust conversation that we've had here today. Thank you everyone for this thought-provoking and thoughtful conversation.
Thank you.
And just to add, just as a reminder, we will be posting the recording to the VMS website for those who weren't able to join us today. And we will be providing information in our newsletter so that our members know to take a look and learn about all of your candidacies. So thank you very much for joining us this afternoon.
Thank you, VMS.
Thank you.
Thank you for such a well-organized event.
Thank you, everyone. Have a good afternoon.